While nearly 9.5 billion doses of COVID vaccine have been administered across the planet, less than 10% of low-income countries have received a dose.
Yeah, true, but that's about to change. Let's see the complete information.
It's called Corbavax, and it's expected to be available beginning in February, courtesy of mega medical manufacturer Biological E Limited, based in southern India. India's health minister announced its emergency approval in December. By then, Dr. Maria Elena Batazzi and Dr. Peter Hortez, co-directors of the Texas Children's Vaccine Center in Houston, Texas, had been working with BioE for nearly 2 years to create the vaccine using existing technology.
What this new vaccine technology brings to the table is the large quantity of production that we can produce, right? You know, we're talking Biological E in India already mentioned they could do 100 million doses a month. It can raise a little bit the confidence of using this type of vaccine because this is a conventional technology.
New Delhi has already ordered 300 million doses. Manufacturers in Indonesia, Bangladesh, and parts of Africa are also in discussions to produce Corbavax. Dr. Elizabeth Mack leads the Pediatric Critical Care Unit at the Medical University of South Carolina.
There haven't been diseases of this proportion that were controlled outside of vaccination efforts. So certainly really excited.
So this is,
Public health officials say immunizing more people with a more effective vaccine is critical to preventing additional variants from developing. Dr. Maria Van Kerkhove of the World Health Organization.
So it is very unlikely that Omicron will be the last variant you'll hear us speaking about. This is why it is so critical that we focus on getting vulnerable populations around the world vaccinated and that we increase vaccination coverage in all countries.
Millions across the developing world have received China's Sinovac or Sinopharm vaccine. Both have proven to be less effective against the Delta variant and Omicron. Dr. Batazzi says Corbavax could provide more long-lasting protection.
I think it can fill that gap because we're already seeing that individuals who participated early in 2020, they are being followed many months later. They still have a very durable immune response.
Still, Corbavax has drawbacks of its own. It can't be modified as quickly as mRNA vaccines, and just like existing vaccines, it will not prevent COVID-19 disease completely or its spread. It also has yet to be approved by the World Health Organization for distribution through the Global Vaccine Initiative, COVAX. But with each step towards more jabs and more arms, public health officials say we will be closer to a world with more immunity against COVID-19, no matter where you live.